So we were talking a little before you joined us about pediatrics and trying to decide what would a child ever have to be anxious about. But I think
Mhm.
a lot of times we think about pediatrics as just little people medicine, little people, little doses of the same medicines that big people need. So what are some of the fundamental differences in the approach to children versus adults as patients?
Sure. I think there are a couple things that stand out to me that make the practice of child psychiatry just a little bit different in seeing these young ones. Probably one of the most notable is the number of informants it takes to help come up with a plan and to figure out what's going on with kids. I think all of medicine requires some degree of kind of detective work and following the clues, and often extends beyond kind of the primary story that the patient can give. And so I think, while a lot of my, colleagues have, maybe blood work and physical signs and imaging to use, which I do use at times, in kids too, it's a little bit different in that, I'm encountering the child, but then also working a lot with the family, often getting, maybe some additional testing or hearing from the school too. And so often I get to hear the voice of a child and the child's kind of community together, letting me know what it is that they're seeing. Also in seeing kids, all of those early thinkers that people mention here and there, like Piaget and Erickson and Mahler. I mean, we use those developmental frames a lot, and so there's, on one level, we're looking for kind of a diagnostic, checklist, but we're also trying to, use a framework of thinking, what is this child's developmental level? What can we actually expect them to experience? What are some of the emotions or their coping strategies that are just a part of, who they are right now at this age, versus some real pathology that can cause them some issues or trouble down the line.